There's no problem with life. You're the one with the thoughts. You're the one with all the responsibility.
What does it mean to steal?
On Christmas Eve on the 25th, a family demands answers after the death of a patient that occurred in the early hours of December 25th at Pimentas Hospital in Guarulhos, São Paulo. According to the family members, the patient was admitted to the hospital on the night of Christmas Eve, the 24th, with stomach pain, a urinary tract infection, and high blood pressure. The family claims that no tests had been performed beforehand. Before the administration of an injectable medication, which was given by an intern, they were not informed about which medication was being administered. After the injection, the patient reportedly had seizures and was taken to the emergency room. From that moment on, the family members reported that they were no longer allowed to accompany the patient during treatment. Around 12:50, the family was informed of the death, with bleeding in the head given as the cause of death. Information that raised even more questions, since, according to them, there was no previous history. The recorded video also reports one of the family members accusing the intern of being under the influence of drugs. The case is still being followed by the family, who say they are seeking clarification and a full investigation into the case, the circumstances of the death. Brazil, it's tough, huh? Every day there's something new, as you saw in the video, right? Here we have the heat of the moment, and obviously, if you were me, if you were the family member, I would be caught up in the emotion too. But anyway, let's try to understand the report here. Let's start with the patient's complaint. That's why I always say, record everything in the medical chart. The main complaint, especially if you are a triage nurse, if you don't record the main complaint and just write a bunch of things, that's going to mess everything up for everyone. But here I'm not saying who's right or wrong, it's just a warning. There's a lot for us to learn here in nursing, okay? The complaint was stomach pain, urinary tract infection, and high blood pressure. Incorrect. I'm unsure what was classified, but something's wrong. First, you can't report 3 things. Urinary tract infection, stop and think. The person goes to the hospital with a urinary tract infection, pain, stomach pain, and high blood pressure. That's why I say you have to prioritize the information. She didn't have all 3 things at the same time. Nobody suddenly has pain when urinating, stomach pain, and high blood pressure. There was definitely something already going on, but try explaining that to the family now. It's not the right time, but that's why I say it. I triaged patients for many years. I used to ask, there are 3 things you're reporting. What bothers you the most that made you come here now? Ask that question and write it down. Chief complaint. Let's give an example. Stomach pain. Chief complaint. Pain when urinating. Because urinary tract infection is a diagnosis. High blood pressure. That's the main thing. What's the reason? What brought her here? 3 things. Unfortunately, one thing cancels out the other. Because we don't know. It could be that the patient really had all 3, but that already makes the patient a complex case, not a simple one. Do you get the point? But I'm saying this as a warning. Now let's go. The family claims that no tests were done before the medication was given. Guys, I don't know what the medication was, but let's understand the following. You don't need a medical test to give a painkiller to someone who's in pain. Where did you see that? There isn't? If the complaint was stomach pain, then a painkiller would be given, for example, or an anti-inflammatory, I don't know. Second, do you need tests to give medication for high blood pressure in the emergency room? Obviously not. You must give medication to reduce blood pressure, such as in a hypertensive crisis. But anyway, what about a urinary tract infection? Urinary tract infection, guys. There's no way to give a medication to relieve a urinary tract infection. Antibiotic. Antibiotics take time to work, so you have to understand if it hasn't gotten worse and turned into a case of sepsis, for example. But what I mean is, I'm not justifying the hospital staff here. But it's for us to understand the following. Do you see the problem with having unspecified complaints? We have 3 complaints. A person who arrives at the hospital with 3 complaints. This is a major issue for the attending doctor and for us. For example, if I give a painkiller for pain, will it lower blood pressure? It won't. Will blood pressure medication relieve pain? No, it won't. And none of these medications will relieve the urinary infection. The pain is when urinating. So first here I'm talking about the medication. I don't know which medication was given. And if she was having a hypertensive crisis, it explains that she had a hemorrhagic stroke. I'm not saying it was done right or wrong. I'm saying that if it really was a blood pressure issue, the blood pressure could have been in a hypertensive crisis, which leads to a hemorrhagic stroke. So that would explain the bleeding in the head, bleeding from the nose, because the blood pressure is very high. I'm not saying that the medication had a positive or negative influence on the outcome, because there's no medication name here. Then the family claims the following, that after the injection, in other words, after taking the medication, the patient supposedly had a seizure. That's the point. Was it just a coincidence, man? That's really bad luck. Giving the medication and the patient having a seizure. Now, if the blood pressure was high, if the blood pressure was really high, like way above 140/90, way above that. Let's think about it. 180/110, which would be a hypertensive crisis. Could that lead to a seizure? It could. A urinary tract infection? That wouldn't cause a seizure. Stomach pain? Only if it was a heart attack. Because even though the pain is in the stomach, the person might report it incorrectly, and the pain could actually be precordial, just a little lower. But when thinking about seizures, I still consider neurological causes. And when thinking about blood pressure, increased intracranial pressure. That could be a reason for a seizure. The bad luck was giving the medication and having a seizure at the same time. And then you can't really know. Because man, a medication causing a seizure is strange. Really strange. Because here's the thing, a seizure is a disorder in the nervous system. And what medication would usually cause a disorder like that? The medication would reduce any level of consciousness. It wouldn't cause hyperactivity in the brain. But anyway, at no point, look, from this moment on, there are thousands of reports where people couldn't stay with the patient during treatment anymore. I understand that you can't follow, because during procedures, only professionals can stay. But let people know what's happening. Like, look, this happened, that happened, we're trying. Someone gives this update to the family. What I often see in hospitals. And that's how it is. Unfortunately, this happens. No one gives the family an answer. People are left outside, sick with worry, anxious, wanting an answer, and nothing, and nothing, and nothing. And after a while, the doctor comes and speaks. Unfortunately, it ended in death. But how did it come to that? He came here with stomach pain. That's why I say things need to be discussed. The main complaint needs to be highlighted. Do you understand the point? And then, the intern, whether it's the intern or not, he was showing characteristics of someone altered using drugs. So that's a problem. That's why I say you need to have the right attitude to work. Because even though I'm not justifying it, whether he was using any substance or not, but depending on how you work, you can end up looking like someone who really is on something. Whether he was or not, I don't know. Maybe the person really smoked, maybe he snorted something or drank something, I don't know. I wasn't there to see it, but the family says it happened in that sense. So guys, be careful with how you dress, even in your hospital uniform, but be careful with the way you dress, the way you speak. And be careful if you use any kind of intoxicant, don't use it during work hours. For God's sake, that's the least you can do. Our profession already gets dragged down over any little thing, so if we start doing this, that's because the family wants an explanation. Because in their mind, she wasn't supposed to have died if she had a urinary infection, stomach pain, or high blood pressure. But what was the main reason? That wasn't told to the family. At least I think the family wouldn't be making all this fuss if it had been. So the family is outraged. Of course, everyone has the right to look for an answer for something that really happened. But this serves as a lesson for those who are triage nurses. Focus on one main complaint instead of several. You can note secondary issues. What was the main reason for their visit now? Document that in the medical record. Nursing technicians, please be mindful when approaching patients. Always state the medication you're administering. Buscopan, dipyrone, hydrocortisone, Tylenol, and explain what it's for. For the family to be aware of what's going on, that's very important. So what is the lesson for us on this side who weren't there experiencing everything and don't really know what actually happened? Improve the writing for the family. Understand that there was only one main reason, say the name of the medication, and pass the information on to the family as soon as possible. You can't constantly update the family, but they should at least know a bit about what's going on. What do you think? Want more content like this? So that we can stay alert, be more aware in our daily work?